A silent dual crisis is gripping a generation. As youth mental health issues reach epidemic proportions, a parallel and alarming surge in vaping and cannabis use is taking hold. New research and data from health authorities now suggests these trends are not merely coincidental, but deeply intertwined, with substance use acting as both a symptom of underlying distress and a factor that exacerbates it, creating a dangerous feedback loop. Let's explore this further with Professor Olalekan Ayo-Yusuf from the University of Pretoria. Professor, I appreciate your time. Now, what first alerted you to this link between vaping, cannabis use and youth mental health?
Good afternoon to you and good afternoon to your viewers. So, generally, the literature is beginning to pick up an increase in use of cannabis, and South Africa as well, as since 2017, when the Constitutional Court ruled that you can have cannabis in your for private use. We were then interested, and because about that same time, the tobacco industry and vaping industry have aggressively marketed vapes in South Africa, and we started seeing a significant increase in vaping. So there was interest to know whether the vape was going to replace the cannabis, or cannabis was going to replace vape with easy access to both post-2017. More importantly, the UCT University of Pretoria study showed there was an increase in psychotic adolescent admitted related to cannabis use, moving from 35% before that ruling to 65% of psychiatric adolescent admissions associated with the cannabis. So we looked at then the university students, 15 universities in South Africa, and analyzed the pattern of use and found that most young people use both vapes and smoke cannabis. But more concerning is a lot of those who use vape, a third of them also use THC. THC is the substance that makes you high, and it is the potency of THC is associated with psychosis.
Now, how serious is the trend? Are we already in a youth mental health crisis, or is this a warning signal?
Generally, in South Africa, it's estimated about 1 out of every 10 adolescents has one form of mental health disorder or the other. Clearly, that is crisis on its own, given that the access to mental health is not adequate in South Africa, both for adults and more so for younger people. There's still a lot of stigma. So what then happens is that it will seem like a lot of young people self-medicate to get out of their depression or anxiety. Clearly, with the high unemployment rate amongst youth, with the economic downturn, there is also an increased risk for mental health disorder. So when you mix this together, we definitely facing a crisis if we do not cover the policy gap that allows both cannabis and vapes to be easily accessible to young people. Currently, we've been discussing the Tobacco and Electronic Delivery System bill in South Africa since 2018, 7 years just discussing. In the meantime, we are having this evolving situation where the nicotine in vapes actually potentiates the THC in your cannabis when you smoke it, and vice versa. And of course, that's not good for your lungs.
Now, one of the things that we understand is that you've proposed a 21-year age restriction and a tougher enforcement. If that's your standpoint, how will those measures make a difference, Professor?
Indeed, the brain develops from the back part of your brain to the front. And that process, it gets to maturity at about age 21. So if you do have access, it should be beyond that time. So your risk for psychosis when you use cannabis increases if you start at a very early age. Usually if you start before the age of 15, and we found out that most of those who experimented with cannabis started between the age of 12 and 17, and then vape follows. So we're saying that you can protect young people by increasing or making sure that the age of access for both vape, in my view, because most of these vape now have THC as well. Like I said, 30% of those who vape also use THC. So if you increase the age of access to 21, you can at least protect the brain, the developing brain about that time. And it will also produce a social, change the social norm that adolescents or young people should have access to these substances. And of course, we need to also cover the gap in terms of mental health services that are youth-friendly in South Africa.
Prof, just to wrap the conversation, what role do you think should schools, parents and health professionals play in early detection and, more importantly, in prevention?
It is indeed important to have a very coordinated approach to this, because there's no point having law enforcement work on their own and there's no public health response. So there should be a coordination in schools to ensure that parents and school authorities have an understanding of what the, for example, the current private purpose, Cannabis for Private Purpose Act says that you can have a private access to it in your private space. But how do you protect young people in that private space that have access to it as well? So, in fact, I was quite impressed that General Mkhwanazi in KwaZulu-Natal issued out a statement trying to clarify what this act is and what is not, because many people still do not know. They think they can carry vapes with THC or cannabis around just because of that. So we need that education and, more importantly, public health response to make sure that the government and the National Department of Health in particular should increase awareness of the danger and pass the bill, the current bill that protects the advertisement, the aggressive marketing and advertisement and uncontrolled access to vapes, including those who have strong THC materials.
Shocking and worrying figures. As many as 1 in 10 of those young people and adolescents suffering from mental health issues.